In the case of hearts, you had 6 hours or less within which you had to transplant it, at which point the organ was non-viable over that. In harvest for burn patients, and it could also be done for joints and bones, as well as for the corneas. I am signed up as a donor for sure, as are all my family members, because when I exit, I'm not going to need these organs. If I can help 7 other people live their lives to their fullest and do something for someone else, I would gladly pay for it.
Hey guys, Dr. Nene here. I practice as a cardiothoracic, vascular, and general surgeon, and I'm now a health tech innovator who wants to improve lifespans and lifestyles. So stay healthy, stay curious, and keep watching.
So organ sharing is a means of finding patients who are at risk of losing their lives secondary to organ failure. And there's a combination of solid organs, and each one has a time period over which you can transplant it. In addition to that, there's living related now. There's organs which are in patients which are alive that you have to take and they have a shelf life. And then there's cadaveric in organs which you can take. So let's break it down. In livers, kidneys, and pancreases, we can actually take either the organ or a part of the organ from a living related relative, provided all of the immunology is correct, and transplant it. And in doing so, we can save them. And in the case of kidneys, for instance, this has been a remarkable way to save lives, because I'm sure you know, but in dialysis patients, they have up to a 50% mortality at 10 years. And when you put a kidney in those same patients, you can actually give them a normal lifespan. Similarly, with the pancreatic islet cells, as well as transplanting a portion of someone's liver in a living related transplant, you can save their lives. The liver in particular can regenerate pretty dramatically, and if caught in time before the patient ends up having dramatic end organ damage to these other organs, you can actually save lives. The next category is patients who will require a transplant. And the way it worked in the US is that they had a United Organ Sharing system, UNOS, which then worked with ROPA, which was the Regional Organ Procurement Agency, and transplant coordinators. And when a patient succumbed and were brain dead by a strict criteria that neurologists did the testing on, the family was approached, and in many cases in the US, with driver's licenses and such, we would sign and say we wanted to be an organ donor, and that would guide our families to doing what our wishes were. In the US as well as India and globally nowadays, a lot of times it comes to the next of kin. And so this is something which I'll make a point on, that you should talk to each other before these things happen, and even leave it in a living will, or say, look, this is something I would want to do if something befell me, that I would want to save 7 or 10 other people's lives by donating my organs. But in those cases, once the testing was done, then we would go in and we would have a transplantation team that was on the transplant side, where you would put the patient on bypass and exhume the heart, and then you would have an organ harvesting team that would go out and harvest the organ. In the case of hearts, you had 6 hours or less within which you had to transplant it, at which point the organ was non-viable over that. And so it created all kinds of interesting situations, because it was always in the bump of the night. We'd be flying on a Learjet, taking an ambulance, getting in, getting out, and occasionally you'd have Air Force One blocking your way. And so that's another story for another day. But the end result was, if you were on the transplant team or the harvest team, the patients would do well. They were carefully selected. They were prioritized depending on how sick they were, if they were on a ventricular assist device, if they were on any type of life support. And we would then prioritize the sickest people first and then work it out, and they would be within that 6-hour window. Similarly for lungs, we would have to go in, and when we went in as a harvest fellow, you would have to go in and examine the cath films, look at the patient, look at all their laboratory tests to make sure the organ was good enough to transplant before you took it out. And so all of this homework was done by the transplant coordinators as well as by the harvest teams. And then the transplant team would stand by with the patient on bypass, knowing that they were coming in a very closely knit kind of operatic structure. Similarly with lungs, it was the same way. Then there was another class of transplants which were cadaveric. And what that means is that the patient didn't need to be brain dead, they could actually have succumbed. And within a certain period of time, you could harvest the organs and they would still be good. And that could be done for kidneys, it could be done for livers, it could be done for pancreas to some degree. It could also be done for skin harvest for burn patients, and it could also be done for joints and bones, as well as for the corneas. It just so happens corneas are one of the most transplanted organs of all, mainly because they don't have a blood supply and they are very, very hardy and really don't need long-term immunosuppressive management. And so the three categories were living related, they were brain dead but alive, and cadaveric. Now, how does this relate to you and me today? The idea is that as India is getting older, as we're getting more diseases which are acquired, like heart disease, diabetes, and other things which cause your organs to fail, we're going to need more organs for patients to be transplanted. And part of this will be living related, and that system is working well because it's your own family member in many cases doing this, and we do have sophisticated surgeons in the metro areas and now in tier 2, tier 3, tier 4. But what we'll need to do going forward in India is to have a standardized UNOS and ROPA, a United Organ Sharing Agency, and a Regional Organ Procurement Agency, which is centralized, has a database of patients who are on the wait list and getting treated. And then we'll need to have transplant coordinators in each and every hospital who can go in and hopefully articulate to the families what the urgent need is and how they can save 7 or more people's lives with the donation of the organs. I think finally, the thing to say is that the most rewarding time for me was seeing these patients thrive who got a heart or got lungs or got other organs. And I can tell you, I've seen it from the inside out, and it is something beyond. I am signed up as a donor for sure, as are all my family members, because when I exit, I'm not gonna need these organs. And the truth of the matter is that if I can help 7 other people live their lives to their fullest and do something for someone else, I would gladly pay for it. So I hope you've liked what I said, and I hope you'll subscribe for more of these episodes. I hope you'll share this with everyone and make it a mandate. Think hard about signing a living will or talking to your relatives that if I ever befall some kind of horrible situation, that you can at least use my organs. I know in India, getting healthcare is hard enough, and transplants may be beyond that to some degree. But I think we need to try, and we need to get educated, and we need to work together to make this a reality so that we can treat more people with really long-term illnesses. And remember, we're a young country. 2/3 of the country is less than 35, but as we age, this is going to become a bigger problem. And in many of these cases, we can change the way someone is productive. I'll give you an example, dialysis. If you're on dialysis, you're going 3 times a week and you're basically incapacitated. Whereas when you get a kidney transplant, guess what? Your life comes back and you can be productive for your family and your friends. And so it's one of those most amazing sacrifices you'll ever make, where one person will save a whole host of others. And the family members will participate in this, as will the patient, and it will make a difference in the world. Thank you for watching, and thank you for joining us.